Hey everyone, it's Dr. Charles. Just wanted to spend a couple minutes with you and help you learn to assess your client's heart rate information. Assessing a client's heart rate information is critical to setting up their cardio program, as well as helping your client to achieve weight loss and fitness improvements. The assessment I want to talk to you about is the nose assessment, and that assessment looks at when a client transitions from breathing in and out of their nose to breathing in and out of their mouth. We want to record that heart rate when that transition occurs, and that's the information that we're going to use to set up their cardio program. So let's get started. Hey Paula, thanks for coming in today.
Sure.
Great. Well, what we're going to do today on the treadmill is we're going to do your heart rate assessment. Is that okay?
That's great.
Terrific. So what we're going to do is it's going to be about a 10-minute assessment where I'm going to increase the speed of the incline and kind of monitor your heart rate throughout the process.
Okay.
What I need from you is, one, just to keep up with the speed as I progress it through the workout, and then two, I want you to only breathe in and out of your nose, not your mouth.
Okay.
Okay? As things get harder, you're going to have the tendency to want to open your mouth and breathe. Try not to, and when you feel like you're close, go ahead and raise your hand to let me know that you're about ready to breathe out of your mouth, okay?
Okay.
And then from there, I'll coach you through the rest of the assessment.
Sounds good.
Sounds good? Okay. Now that we're warmed up, I'm going to get you into your exercise pace.
All right.
Alright, so we just got our client warmed up and transitioned them to the exercise pace. The exercise pace is going to be dictated by the height and fitness level of our clients. For example, someone who's tall might walk at a pace of 4.0, while someone who's short might walk at a pace of 3.0. In addition, someone who's fit might be at 3.8, or someone who's deconditioned might be at 3.3. So you're going to have to use a little bit of your judgment call based on your knowledge of the client. But once we have that exercise pace set, that looks like a natural fast walk for your client, then you can proceed with the assessment and start to increase the incline at a 1 or 2% depending on the fitness level of your client. Alright, we're almost there. Just keep breathing in and out of your nose for me, and raise your hand when you have to breathe out of your mouth so I can get your heart rate information. Alright, perfect. Let me slow you down. You did a great job. The assessment's over. If your client still hasn't hit their threshold at 8%, we're going to need to transition them from a walk to a jog, and then increase in increments of speed instead of incline for the rest of the assessment. Alright Paula, you're doing great. We're at an 8% incline right now. So instead of increasing the incline more, I'm going to have you go into a jog. So if you can just start jogging for me right now. Excellent. Hey Paula, I know this is getting a little difficult for you, but if you could, just put your hands by your side and walk normally for me.
Okay.
Great. Just a little tip during the assessment, make sure your client doesn't hold onto the railings, and that way you get more accurate heart rate information. Alright Paula, the assessment's over and you did great. Now the reason we did that was to get your heart rate information to set up your cardio program, and the main thing we can do now is design a program for you where you're going to burn fats instead of sugars, and we can guarantee that now you're going to lose weight and get in better shape.
Awesome.
Alright, great. Thanks a lot.
Thank you.
Okay, so it really is that simple. Just make sure to practice on other trainers and yourself before you try it on a client. Also remember, you have 10 minutes during the assessment. That's a really great time for you to talk to your client, find out what they're doing with their cardio currently, and also to talk to them about heart rate monitor training and the importance of this program that they're about to start. It really is a great tool that's going to make you a great trainer. For any additional information, just reference the website or go to my blog.